Diagnosing and staging lung cancer involves a series of steps to confirm the presence of cancer, determine its type, and assess the extent of its spread.
See, lung cancer is suspected on the basis of symptoms. The symptoms are like somebody will come to you with complaints of cough, breathing problem, would be chest pain. Cough may or may not be productive, and sometimes there could be blood also during coughing. So coughing, shortness of breath, chest pain. Sometimes the cancer can have systemic component, so there could be loss of weight as well as loss of appetite. So the suspicion is made on these symptoms. They can occur sometimes in pneumonia also. But we know that the cancer symptoms are persistent. They persist beyond 2 weeks, 3 weeks, 4 weeks. So once we suspect cancers based on these symptoms, then we will investigate. So initially patients are investigated using a chest x-ray, but yes, now the better modalities are using a CT scan. A contrast enhanced CT scan of the chest is usually something that picks up the various findings of lung cancer, followed by biopsy. Biopsy is an investigation which is done in order to get the sample of the cancer.
Once the initial diagnosis of lung cancer is confirmed, further diagnostic steps may be taken to gather additional information that is crucial for treatment planning and determining the extent of the disease.
Once the diagnosis of cancers is actually confirmed and established, we want to see the extent of the disease, because cancer is a disease which can spread from one organ to another organ. From the lungs, the cancer can go to the liver, brain, and bones. So we do a systemic scanning that actually includes taking a whole body PET scan that gives you whole idea, the idea about the complete body. And yes, in addition, we also do a MRI of the brain, because the lung cancer can go in the brain, and we need to find out what exactly is happening in the brain. So these are how we actually find the extent, confirm the diagnosis, and then start your treatment.
Staging is a crucial aspect of determining the extent of lung cancer, and it plays a significant role in guiding treatment decisions and predicting prognosis.
Lung cancer, the stage means the extent of the disease. So yes, cancer should always be staged, because that helps to determine your treatment. Staging is done, as I said, by using some kind of imaging, like PET scan these days is preferred. If the PET scan facility is not available, then we do a CT of chest and abdomen. In addition, we are also doing an MRI of the brain. So after doing this investigation, we'll find out what is the extent of the disease. Is the lung cancer is just in the form of a lump limited to the lungs, or has it gone to the nearby adjacent, what is called as the lymph nodes? Sometimes there could be just 1 or 2 lymph nodes, sometimes there could be extensive lymph nodes, and sometimes the cancer could have gone beyond the lymph node to various other organs, such as it could go to the other lung. It can form fluids, what we call as the pleural fluid, and yes, it can also go to the other parts of the body. So depending upon that, we say if the patient is in stage 1, 2, 3, or 4 of the lung cancer.
In order to pick up cancers early so that they can be treated fully, lung cancer screening has to become one of the established modality. For that, screening should not just be offered to the patients, but also the individuals who have yet not developed the symptoms.